Dr Lise Hansen, what a pleasure that you're joining us on the very first ever episode of Conversations with Anna Webb for Edition Dog Magazine. Welcome.
Thank you. Thank you for inviting me.
Well, today, Lise, you're a Danish vet, and Scandinavia will kind of be brought into this conversation, as you know well, for many reasons, because we're talking about the rather landmark new guidelines, well, only ever guidelines, by the World Small Animal Veterinary Association. That is the organisation that globally represents vets, GP vets, recommending best practice. Lise, would you say that?
Yeah, sure, that's fair. And I think it's important to say before we start talking about anything really that we're going to be talking about dog reproduction. And I'm not an expert in dog reproduction in any shape or form. I'm just a vet who has a keen interest in staying informed and a passion for helping dog parents or pet parents stay informed.
Oh, indeed, Lise. No, you really are a very passionate and great vet in that you're integrated and that you embrace the complementary side of veterinary care, not least homeopathy, herbs, and of course feeding a natural whole food and species appropriate diet. So in many ways, you're quite different from many other vets, I would say, having met a lot of them in my long lifetime now. And you are also, Lise, the author of this book, the complete book of cat and dog health, which I always have it close to hand. It actually was the first publication to talk in advance about what we're going to delve a bit deeper into now, which is the WSAVA guidelines on spaying and neutering, which are quite landmark, to say the least, and they are still very, very new in that they were only announced in June of 2024, so about 6 months ago. We did record a podcast at that time, which I was awfully proud to air as arguably the first podcast ever to air the news of this. And so it's really great to have you here today to just see how in the last 6 months as well, how have vets been taking this new guidelines and similarly pet parents?
Yeah, well, I mean, it's a new world now in terms of how we're keeping dogs. Can I just talk a little bit just to put this into context? Because I think it's a fascinating story, really. It used to be that neutering or not neutering a dog was not something that was given much attention. It wasn't really a topic. I mean, if we go back 10 or 15 years, it was sort of thought that sex hormones had to do with reproduction. And if a dog wasn't going to be bred, if they weren't going to be allowed to reproduce, then we might as well neuter them. We were aware that there could be side effects, mainly 3 side effects that we've known about for as long as I can remember. The one, that they might develop what we call puppy coat, the sort of woolly coat, which is a cosmetic issue only. We were aware that dogs can become overweight when they're neutered, and we were aware that as many as 1 in 5 female dogs may develop urinary incontinence after neutering. But that was really it. And overall, in many places, it was viewed as a fairly safe and okay thing to do, and something that might make things easier, might make keeping dogs easier. And the really interesting part of this is that just the geographical differences. In Norway, as you were alluding to before in your introduction, in Norway, neutering dogs is illegal. Unless you're doing it for specific health reasons, unless, if a dog has a testicular tumor or a womb infection or whatever, you're obviously allowed to treat them, and that may mean neutering. But routine neutering of dogs is and has for ever, as far as I'm aware, been illegal in Norway. It's just seen as a completely outrageous concept even. Why would you? In Sweden, it's not illegal, but it's very unusual. And almost all dogs are left intact. It's considered somewhat unethical to even contemplate neutering healthy animals. Whereas if you look at the US, it's almost the opposite. For years, they've had this mantra of you must spay and neuter. And it's been the understanding over there that responsible pet ownership really was getting your dogs neutered. And the standard, as far as I understand it, is to neuter puppies before they're even sold, before they're taken away from their mother. They are neutered. So it's just amazing to me that without much debate, without anybody really noticing almost, we've had these completely approaches to what we do about dogs and their sex hormones. The UK, Denmark, most of Europe, I think, have been somewhere in between those two poles. Where I am in Denmark, just under half of dogs are neutered. In the UK, it's closer to 70% of dogs that are neutered, but at least it's not unusual to have an intact dog. But in the States, it's unusual to have an intact dog, and it's Norway, it's very unusual to have a neutered dog.
You see, so Lee, but this is interesting, isn't it? Because
It is.
the WSAVA is the World Small Animal Veterinary Association, and they are responsible for global guidelines. So this is going to be a very interesting subject to kind of unravel, particularly as rightly you say. I mean, when I brought Molly into my life over 20 years ago, it was considered, right, when are you going to book her in to be spayed? In the UK, you spay from 6 months. You didn't really kind of talk about it. I was reticent to do that because I was already aware of many conversations in the space about when is the right time to neuter. And this is something that we've talked about before, and you mention in your book how the conversations around neutering has changed. So it's gone from definitely just put me in and get it done to, but when might it be better for my dog age-wise to get it done? But now we're in the later stage where there is scientific evidence presented by the WSAVA to say, look, guys, stop, wait a minute. Spaying and neutering can kill your dog.
Yeah, I mean, exactly. That's exactly it. It went from when should we do it to, well, from just do it to when should we do it to, well, why would we do it at all? And it's that conversation developing came from, as we were just saying, a place where nobody gave it second thought. You just did what you did, probably without even thinking about it.
Yeah, no, absolutely. Look, as you say, vets didn't know anything then, but the point is they do now. I mean, look, Lise, I've got Prudence sat beside me. She's now nearly 10 years old and she is entire. And, it's been pretty hard keeping her entire. It has involved, a few heated conversations with vets who want to spay her for no reason at all. She is still alive. She hasn't had a pyometra. She's actually at the end of her season currently. What are these messages going to get across to regular pet parents? Number one. And, we've got all this science data now in the WSAVA guidelines, which are available to download. I've done that. It's quite a heavy read, but, it's not incomprehensible. There's some really interesting points in it. But this is a compilation of scientific evidence that has been put together over about 30 years, bit by bit, of some leading veterinary lights across the world. So we now have hardcore evidence of health risks. So, Lise, how are vets going to convey these health risks to a first-time dog owner? Over to you.
Well, as quickly as possible, I think is the best answer I can give you, and that's why we're here, aren't we? Because it's so important now that this information exists that we get it out there. And I think to have the conversation, it just helps to be aware of this historical timeline where it used to be something that we just didn't think about then, and what we did was just based on societal expectations.
But what are the health risks? What does the document highlight? I know, for example, it focuses on different breeds. So golden retrievers were studied, for example, and the results coming from, say, the golden retriever studies can't, of course, from a scientific perspective, be directly correlable perhaps to a miniature bull terrier because they are very, very different breeds of dogs. Vizslas, for example, I mean, am I right in thinking it is more likely to provide health risks to larger breed dogs than smaller breed dogs?
Yes. I mean, the important event is as you say, the WSAVA, I've got them somewhere, here we are, the WSAVA guidelines for the control of reproduction in dogs and cats. It's 136 pages of scientific papers and evaluation of scientific papers. And let me say straight away, I'm not suggesting that pet parents sit down and read that. It's a scientific document and it's written at vets. But what it means is that I keep going back to the history, but I think it's important because 10 years ago, we had the first study that indicated that neutering could be problematic, which was the golden retriever study. And then there was a flurry of studies. So there was this period, which has lasted for about the last decade until 6 months ago, of an increasing awareness that this could be problematic, but everybody being maybe a little bit unsure of the pros and cons and what does this mean in real life. And then came the WSAVA report in May 2024 and just absolutely drew a line in the sand. And what it means is the jury is in now. And we have this expert group, these experts in the field of reproduction on behalf of the WSAVA, going through all the evidence to be able to give vets around the world exactly what they need in order to advise pet parents on neutering. And they go through it all, of course, and then there are differences between breeds. There's lots of stuff we don't know yet about the differences between breeds, the stuff we don't know about the significance of the age that we neuter. But they provide a very clear conclusion. You know, they say, as you mentioned, that the risk is higher in large breed dogs, but they are also very clear. And if we just to sum it up very, very simply, they're saying unless there's a very, very specific reason in your case, we're done neutering dogs. You know, it's not a safe option. It's not a matter of pros and cons. It's the risks of neutering very, very highly outweigh any pros for the general dog. So it's just no longer something that we can do and still be responsible about dog health. It's important to say when I say that I'm talking about routine neutering of healthy dogs. That sort of, Molly's going to be 6 months, let's book her in, is completely over. And I find, particularly when I speak to American colleagues or hear the debate going on over there, because it's obviously going to be based on the way things were happening before, as we just talked about, is going to be more of a challenge to Americans who have been told the exact opposite for decades. And suddenly they're being told it's not safe to neuter. And it seems to me that when you hear the rhetoric coming out of the States now, they're saying early spay and neuter. They're saying that early neutering is harmful, early spay and neuter is harmful. Right. And that's not what the WSAVA report says. No, it says neutering is harmful.
Full stop, which is really, really good. I mean, in America, I've heard they're looking at the options of an ovary sparing spay, for example, because they do have this very strict culture, and perhaps, doing a vivisectomy,
sure.
I think it's called,
sure.
Isn't it, in the boys. But, that's all fine, and that's going to unravel obviously in the States. But as you say, going back to what we're talking about, which is the WSAVA guidelines, which are going to be issued to America as well, because they are a global organization. It's interesting that in the guidelines, obviously what's stated really clearly is the responsibility of the actual dog owner, guardian, parent, and their capability, I guess, to actually cope with a bitch on heat and ensure that she won't get pregnant, and to understand the whole picture surrounding a bitch being on heat.
Yeah.
And similarly, that their situation, is there an intact male in the house, that's going to perhaps impact on the decision. And I think the WSA, now, what was the acronym? Was it an R?
Yes, no, exactly. I love that part of the report because as you just said, they go through all the studies and all the risk factors. And I don't think I answered your question properly. What are the risks? Basically, it seems to be across the board that neutered dogs have higher risks of developing cancers, osteoarthritis, ligament disease, urinary tract illnesses, allergies, autoimmune disease, diabetes, thyroid disease. They are just more sick, or there's a much, much higher risk of them becoming sick with all of these illnesses, some of them fatal. And so it's not one thing, it's just across the board, they are less healthy if they are neutered. And the report goes through all these risk factors and mentions all the studies and keeps repeating, if someone is considering neutering, you must tell them that it doubles the risk of bone cancer, increases the risk of this, increases the risk of that. But then having written, 100 pages of this detail, and when they get to the part of the conclusion, so how do we act with this information, they suddenly start talking about the person at the other end of the leash, and they're talking about the owner. Because I just enjoy this so much, because regardless of all the differences and risks, etc., 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 the size of the dog, the age of the dog, the breed of the dog, they say when, as a vet, you're faced with an owner with a puppy and you have to advise them on this decision, what you need to consider as a vet is this an RPO in front of you? And I thought when I read this, what is an RPO? RPO stands for responsible pet owner. And what they're really saying is if the person who owns the dog is responsible, sensible person, then tell them not to neuter. I think that's a wonderful way of putting it. And of course, being an RP, I think we should have t-shirts and badges and we should have clubs. We all want to be RPOs, obviously. But if you are an RPO, what does that entail then? Well, if you have a male dog, it means you have to stop him from mating female dogs. You have to understand that sometimes he's going to get a bit aroused and agitated if the neighbor's female dog is in heat. You can't just let him stray. You need to take responsibility for your dog. And in terms of his health, all you really need to be aware of if you have a male dog, apart from not letting him mate, is as he get older, he may develop benign prostate enlargement, just like most men do when they get older. It's not dangerous in any way, but it can be uncomfortable for some, and it may or may not require treatment. That's one thing to be aware of. And the other is that if his testicles change shape or form, if his testicles become asymmetrical or develop lumps or whatever, take them to the vet and get them examined. Testicular cancer is not at all a big killer of dogs, and it's easily detected. And for most dogs, you've got his testicles in your face probably more than you want to if you live closely with your dog. So it's easy to discover. So it doesn't really count as a risk. It just means that if they suddenly look different, then you get them examined. That's really it as far as male dogs are concerned.
Yeah, but what about girls?
Yeah.
Dogs? The main reason vets kind of convince owners to spay is, selling all of these fear factors, really, like, there's mammary cancer, there's cancer of the uterus, cancer of the cervix, there's a terrible likelihood of a pyometra, an infection of the womb.
Can I correct you on that? Because you need to say that in the past tense. This is what we used to think, and this is what we used to say.
Right. Of course.
Because we really have to draw a line in the sand. Summer 2024, it's a new world now because the jury's in and we've got these guidelines to tell us. So, and I get this a lot. People say, oh no, but my vet doesn't think so, or my vet told me differently, or I've heard differently. And that most of us have, because this is new information. So it's really important to say again and again that this is not a matter of opinion. This is not a matter of differing opinions. This is, we didn't used to know this, and now we do.
But Lise, this is precisely why we're doing this episode.
Yeah.
So people that are going to be responding to this episode are pet owners.
Yeah.
And they might be actually people thinking about bringing a new puppy into their lives. They may have had to have spayed or neutered previously. So this conversation is resonating like big bells, okay? So, the thing is, it's important for pet parents to be prepared to maybe argue against their vet, because I
don't think that they should argue against their vet at all. But that was my point. They will no longer, but what they must do is let go of what their vet told them last year, because last year, in terms of this particular topic, is a different universe.
But Lise, how many vets are now moving with the times to do this? I only say this not to be provocative or argumentative, but I'm going to say this. If you look at the World Small Animal Veterinary Association's recommended best guidelines at a global level for annual vaccinations, for example, I know for a fact that the majority of vets, certainly where I live in London, don't abide by those guidelines, at all.
I disagree with that, but I think that's the slightly more complex. I think maybe we should stick to neutering. But I can't say it. I can't say it clearly enough that it's not an argument It's just that we used to not know, and now we do. And I share your frustration in that the transitional phase, when new information is made available, we want to straight away, when something is known, that everybody should be aware of it and everybody should
Well,
implement
yeah,
it.
I mean,
And
that
there
it kind of
is,
is the general point, I would say, when a major organisation
yeah,
like
sure.
WSA.
And I'm very pleased to say, because I was looking at this, I don't know, 3 months ago, say, I was looking through with a colleague, and we were looking at major veterinary groups' web pages, and they had not been changed. I couldn't really find one that had been changed. They were still saying what they'd been saying for ages.
This is
And
my
just
point.
today, and this was maybe, I don't know when that was, in the summer or in the autumn or something, fairly soon after the guidelines came out, maybe a couple of months after. And I was just doing it again, just as I was waiting to log on now. And I was very pleased to see that some of these major groups have now got far better worded. I mean, they've clearly changed how they're putting this forward. They're no longer saying spaying a dog is a good choice to make in terms of their health. They're saying, there are serious reasons not to, and this is an individual assessment, and we need to talk about it. And it's, that they're much more responsible, and clearly they've had a big rethink about how to put this forward. And I was really pleased to see that. I also found some that hadn't. So it's a process for sure.
No, of
And
course.
I think more and more the best way to spread information is just for all of us to talk about it in every context that we can, and this is a real chance for anybody listening to this who has a chat with someone in the dog park this afternoon. Just if you see a puppy, make sure they've heard, make sure they know that this is not something that we do anymore. It's not safe. And then, of course, there can be reasons in the individual situation, in the individual house. There maybe there are difficulties in keeping intact dogs, but at the very least, everybody who considers whether or not to have their dog neutered must be made aware of the risks. That's my mission, and yours, I know.
Well, yes, I know, just a
That's
little
why
bit.
we're here.
No, but interestingly, I did speak to a multi-poo owner only yesterday, and one behaviourist had suggested that he becomes castrated due to his issues, where there weren't any really very complicated issues there, to be honest with you. We've sorted a lot of it out. But however, it's a little multi-poo, lacking a few boundaries, having hit adolescence. However, it was good. The vets did not recommend chopping them off, which, gosh, that would have been the first thing. Well, oh my word, he's not neutered. Right. Well, his behavior will change if we chop off his testicles. Now, there's been a lot of science. I mean, going back to, well, I remember the first one that came out was 2005 when, and it rocked the behavior world, where it was shown that chopping off dogs' testicles didn't make them calm, benign, obedient. No, funnily enough, it involves a lot more than that. And that's something perhaps to discuss quickly now, because I think there is still that myth in some circles of, testosterone dogs, they're going to be more reactive. And that myth has been dispelled for about 20 years, actually.
Yeah, no, I think we were aware. I mean, I think behaviorists were aware of the detrimental effects of neutering in terms of behavior way earlier than these physical health issues have been uncovered. I mean, it is clearly demonstrated that the brain is affected negatively, leading to more fearful behavior and therefore, in some cases, more aggressive behavior. The only behavior that is improved, if you want to put it that way, from neutering will be behavior that's directly sexually related. Males that maybe fight over a female, or females fight when they're in heat, or that sort of situation. But apart from that, the dogs will become more reactive, more fearful by being neutered. Absolutely. And also, we must make it clear that when we talk about males and castration, really, this whole conversation about neutering, we're talking about surgical neutering. We're talking about taking away the sexual organs, so taking away the ovaries in a female or the testicles in a male surgically. There are other procedures, like you mentioned the ovary-sparing spay, where you take away the uterus but leave the ovaries. Find it a little bit of a an oddity, but there are some situations where it may be relevant. Or you can do a vasectomy in males, just like many men have done. They're completely hormonally, sexually the same as an intact dog, but they're just shooting blanks. Again, I can't quite see the point, because if you can't stop them mating, then you really have a problem. You need to be able, if you're going to have a male dog, you need to be able to not let him mate. You can't just, my concern is if you do vasectomies and or ovary sparing space, that there could be an assumption that you can just let them at it, and that would be very unsafe.
Well, I suppose the thing is, though, Lise, going back to being an RPO, then if
Yes,
you are an RPO, then
exactly.
you would know, hopefully, that a bit of dog management would have to be mixed in to that particular situation of a male with the snip or the vasectomy and an ovary sparing spay. But yeah, and I think perhaps that is quite a hurdle, I would say, in this day and age, to find RPOs.
Well, I'm far more positive than you are. I
I
think we're
know,
all
I'm quite doom and gloom actually about it. It's just like talk on the news about, so much stuff, a dog that fell in the
sure.
Thames, that dog should have been on a lead on a towpath. I mean, it's just called a no-brainer, talking about, don't walk your dog close to a cliff when you've got a 90-mile-an-hour wind. There will be people doing it, so it really is, or simply understanding some boundaries so that, you aren't charged a ridiculous amount by a veterinary clinical behaviourist for a problem that can be solved in a 30-minute conversation with a few WhatsApp messages to back it up, and you will have a perfect multi-poo.
Sure.
So
But I think
feel
I was going to say, as a vet, I just see every day how how important dogs are in the families that they belong in, and how far people go to take care of them. And I think that when things don't work out well, very often what's missing is just information. Which is why I wrote my book, and which is why we're here, because people deserve to be informed.
no, and just going to your book, I mean, really, this, because I think a lot of people find new information. If you've never had a dog before and then you're suddenly reading up on dogs and you're like, wow, I never knew that. Dogs have an inbuilt sat nav so they can find their way home across long distances. I didn't know that. Dogs can, alert to impending earthquakes. Really? Wow, I'm sharing my space with one heck of an intelligent sentient being. But it can become overwhelming in all the various studies and all the various trains of thought. You might have a vet that's like, not sure about this. I still think everyone should spay or neuter. There might be, even despite the science, they may still feel it doesn't suit their individual practice.
Yeah, I don't think so. And if anyone comes across that, run a mile.
Yeah, well,
But I think your point is so valid that if you get a puppy for the first time, there is so much information. And the problem right now is that a lot of that information is not up to date. Almost any book you buy about dog healthcare is now per definition going to be outdated. A lot of the websites around are outdated, and maybe even the advice you may get from, neighbors, parents, breeders. Everybody needs to update what we say and what we do about keeping dogs in terms of neutering. So a lot of the information that's available and that's out there and is very visible is wrong.
yeah.
We didn't know, and now we do know.
We do. Absolutely. No, Lise. But this book, having said lots of books are a complicated read, is not complicated. And it's just divided into simple sections where you point out about how to find the right vet for you, for example. You point out a lot about diet, which is something that in these conversations by all means, Lise, it would be lovely to talk about diet with you on another episode.
Sure.
But you really do present a picture that absolutely may not be. A lot of breeders wean their puppies to ultra processed kibble food. That's very common. And of course, I feel that's a shame. Mind you, we're going on to kibble now, but anyway, but that's a shame.
No, but I think it's such a good point, because there are these areas of health. I think there are 4 areas of health: vaccination, neutering, diet, and parasite control, that everybody who takes care of a dog make choices in these fields, but half the time I suspect we're not conscious of making choices. We just do what we've always done, or what some random person tells us to do. And there is science available today that tells us what to do about these 4 different important areas of a dog's life. And in all 4 areas, there's science available that wasn't there a decade ago. So what this means is that for neutering, definitely, but for all of them, actually, we can't just keep doing what we've always done for no other reason than this is what I've always done. We need to look at these things, and we need to be, as someone who takes on the responsibility for an animal, we need to be aware of that responsibility and put it upon ourselves to become informed pet parents, take decisions on a basis of being well informed.
So we're all going to be RPOs.
We are all going to be RPOs, yes. That's our pledge.
Please do check out the complete book of cat and dog health. It's easy to buy on Amazon, everybody. Thank you so much, Lise, for joining us today, and I really hope you'd like to join us again and discuss some of these other 4 areas. Maybe a parasite control topic would be
that's going to be the next big one, I think. Yeah.
Again, of course, because us over here, it all works in a very different way in Scandinavia, doesn't it?
Yes, but there is very much the awareness is there now in the UK. There's a lot of talk. I've been to several veterinary courses and webinars in the last year about sustainability and about not using. We talk about not using antibiotics with the way we used to, but definitely also about not using these pesticides the way we used to. The spoiler alert for that conversation is anyone who's routinely worming, or routinely every month or every 3 months, depending on product, giving their animals drugs to prevent, in inverted commas, because obviously you don't prevent anything, but just to avoid fleas or worms. It's an outdated practice, and it's silly. It'll be the next one.
Thought and inspire people to tune in to the episode that we'll do on that. But I'm so on the page on that, and I guess the hashtag there is test before you treat. And
You said it,
in there now, but we can do that for vaccines too. So let's do an episode all about testing before you treat, which has been championed by Scandinavia, I think. And, I'm proud of that. I'm proud to be half Scandinavian, Lise. Thank you for joining us from Denmark today, Lise.
Thank you for having me. Thank you. Always a pleasure.